Hi, my name is Andre Thomas, and in today's session, we're going to talk about ratios and proportions. Starting off, one thing I would ask that you guys do is definitely look over your conversions. And that's very important. Please look over your conversions. This is what's going to help you along the way. Also, the main formula that we normally use as pharmacy technicians is ratio and proportion. So I work in hospital, but not a lot of people work in retail also, but the main formula that we use is ratio and proportion. So first thing I want to do is at least write one conversion up here because of the fact of the matter, this is what we're going to be going by in a sense with the ratio and proportion problem that I'm about to perform for you, okay? So I want to make sure that you're understanding what's going on, and also you realize the importance of the conversions, okay? So always know and remember and understand that there are 1,000 milligrams in 1 gram, and I'm going to write the word gram out, okay? All right, so that's just one. I just want you to see that. So it's something that you're going to have to also learn and memorize. Once you get to doing these ratio and proportion problems more, then you'll definitely get it embedded in your brain, and it'll be like secondhand or like knowing the back of your hand. Okay. All right. So I like to start off with knowing what the doctor ordered and what we have on hand or the pharmacy has on hand. Okay, so to abbreviate, I'm going to write DO. That's going to mean doctor ordered. Okay, that's what the doctor ordered for the patient. And then on this side, I'm going to write the word on top and then hand. When you do that, it'll keep you in a mindset and also in order to make certain that you put things on the right and proper side so you can keep everything lined up with your ratio and proportion problem, okay? So today I want to work with a medication that we use, of course, and you probably heard of. It's called remdesivir, okay? So remdesivir, beer, okay? So remdesivir is used for COVID, okay? So this medication comes in 100 milligrams, okay? It also has to be diluted. So we've diluted this medication with 20 milliliters, well, 19 milliliters of normal saline, but it comes out because of the powder form, it comes out to technically 20 milliliters as far as diluted. So, and I'm just looking at my notes. So we're gonna start off this way. The doctor ordered, we're gonna use this scenario, okay? We have a doctor patient coming into the emergency room and feeling bad and having symptoms like the normal flu, but it turns out to be COVID, okay? So the doctor is gonna order for this patient 150 milligrams of remdesivir. And I won't get into how that works right now, but I will get into that at some point to show how the doctor bases their a way that they dose the patient off of off their weight or whatnot. Okay. All right. So we're gonna start on this side. So the doctor ordered 150 milligrams. Okay. So it's 150 milligrams. That's what the doctor ordered. Okay. So the best way with ratio and proportion, as far as keeping everything lined up or whatnot, you want to make certain that you keep the units side by side or the same, okay? So the patient, the doctor ordered for the patient 150 milligrams, okay? All right, so at this point, what the pharmacy has on hand, and we're gonna act like for now that we've already diluted the drug. So the drug is going to be 100 milligrams, and this is how we started out. So we're going to go ahead and write our setup for ratio and proportion. So it's a divisor line, equal sign, and another divisor line. And so drug comes on hand, we're going to say as 100 milligrams per 20 milliliters. Now we're trying to find how many milliliters we need to draw up for the patient out of this medication, out of this drug. Okay, so at this point, we're looking for the milliliters. So the easiest way to set this up is to always put whatever the drug is or whatever you have on hand in the pharmacy on the right side. And then on this left side, put what the doctor ordered. So once you know that once you have what the doctor ordered is on the left side, you place an X under what the doctor ordered, okay? So at this point, we're going to cross multiply. So I like to start off on the right-hand side first. It doesn't matter which side you start off on, but I like to start off on the right-hand side. So 100 milligrams times X equals 100 X. Keep in mind, we're looking for milliliters. You're going to hear me say that a lot. We're looking for what we're going to get for the patient in milliliters. Okay? So now, what you want to go ahead and do, you can go ahead and write your equal sign down because you want to make certain that you're keeping everything lined up. Now, you're going to multiply 150 times 20. So that's cross multiplying. So this is what we're doing. We're cross multiplying. So 150 times 20 equals 3,000, okay? So that's 3,000. Mind you, definitely use your calculators. You may not have to use a calculator all the time, but please make sure you keep a calculator handy, okay? And also, if this is making sense to you so far, please let me know by hitting that like button. Also subscribe so that this will help my channel move forward. I'm also going to post this maybe twice a week. So you'll see a lot of this going on and it'll help you out a lot. But otherwise, if this is making sense to you, hit the like button for me, okay? And subscribe, okay? All right. Next, we're gonna now divide each side by 100, okay? So at this point, once you establish the fact that you have 100x equals 3,000, now we're gonna set that ratio and proportion up again. So you already brought the equal side down. So now, we're gonna write another divisor line and another divisor line under here. So now you're going to divide each side by 100. So we're going to write 100 right here and 100 right here. At this point, the way this works, you start off on the left-hand side, then divide this 100 by itself. This is actually just going to cancel out, okay? So at this point, it has canceled out. So now you're going to bring the X down. You're done with this side. So we're still looking for the answer in milliliters, okay? So at this point, we're going to bring the equal sign down again. Again, we're looking for it in milliliters. So 3,000 divided by 100 now equals 30 ml or 30 milliliters, okay? So the answer now is 30 milliliters. And so this is how you do a ratio and proportion problem. And this is the answer. As long as you guys keep this up, keep everything in order, and know that you have your units in place, in the proper place, and realize that you're always looking for milliliters, okay? You should come out with your answer the way you want it to go. And always remember, once you're doing this once you do this calculation, this is actually what you're going to be injecting into a patient's IV bag. But otherwise, this is it for today. Thank you guys for watching, and I'll see you on the next one. Have a great day.